The Directorate of National Pharmacy Services at the Ministry of Health, with funding from the Global Fund and World Bank on Tuesday, commenced a 3-day workshop on digitalizing and logistics management information system into eLMIS at the Paradise Suites Hotel in Kkololi. Omar Job reports.
Some of experts tasked to develop this system are in the country to share with stakeholders the work they did and as well seek the input of stakeholders towards this development. The objective of this workshop is to review the current eLMIS systems paper-based and electronic system, eLMIS system orientation, to validate the initial system setup if it meets the in-country LMSI settings, and confirmation of the phase 1 implementation after the whole system review phased approach to adding health programs to the LMSI. Giving his opening remarks on behalf of the Health Minister, Mamadou Lamin Jaiteh, the Permanent Secretary at the Ministry of Health, thanked the World Bank and Global Fund for their relentless support as he described the workshop as significant to the ministry. He noted that the health sector have been keeping its logistics on manual, and LMIS implementation will boost the health ministry's drive towards greater efficiency and quality service delivery, as he termed the workshop timely.
Today, we take pleasure on behalf of the Honorable Minister to be present here to open a very important workshop which marks the beginning and a very important step in the Ministry of Health's drive towards greater efficiency, towards ensuring greater accountability and quality service delivery. You will all also bear with me that since time immemorial, the ministry has been maintaining its logistics information system partially manual.
Babandin Sabali, the Director of Pharmaceutical Service at the Ministry of Health, noted that it has been a challenge for the health sector for what system to adopt so to address data quality issues in the country, especially logistic management.
For the past years, we've been struggling as what system to adopt so as to address our data quality issue in this country, more especially logistic management information data. We came to the realization that we need to have an electronic version that will connect from end to end. We put our brain together and came up with a proposal, and we sold this to our partners. And thank God, our partners gracefully accepted it, and they are ready to fund it. Here we are today to sensitize our partners, stakeholders, and the senior management team of the ministry as how we are going to implement this very important project in this country.
Director Sabel highlighted that as the Health Ministry is about to start electric management information, the ministry is hopeful that it will revolutionize their way of doing their business, as they far overcrowd lack of a system where the ministry will visualize from central medical store to the last piece of the country. Deborah Asenti Luisa, Fund Portfolio Manager, Global Fund, and Dr. Samuel Mills, Health Tax Team Leader of World Bank, both reassured their office's commitment and continued support for the success of the initiative.
Global Fund Portfolio Manager, Dr. Samuel Mills, the World Bank Tax Team Leader, the Director of Health Services, Dr. Mustafa Bitey, the Director, National Pharmaceutical Services, Mr. Babanding Sabali, the CCM Chair here present, the Project Coordinator, PCU.
I want to say a big thank you to the Global Fund for being persistent throughout the COVID period. Although they were not here, discussions were ongoing. and eventually JSI was competitively selected to establish the system. I also want to take this singular opportunity to thank the Ministry of Health for embarking on this transformative journey.
For Star TV, this is Omar Job.